Imagine a life where you're tuned in to your most authentic frequency, fueling your spirit, freely sharing and using your voice. Now imagine your community, healing without obstructions or inequities, a world where every voice, every life matters.
This is great for the Regional Health Commission because as we begin to think about doing more work in policy and really disrupting those policies and practice that got us into these disparities, that we're able to build comrades across the state to join this fight with us, to understand that we're more alike than different, and really to begin aligning around our similarities to really get the change we need to see in our state.
And you could tell in the conversation that something was really resonating. And so we just spent time in community really listening about what was resonating and what did people think they needed in order to heal and be well. Mm-hmm. And naming trauma and toxic stress emerged as the thing for us to focus on. And so since then, we've been on this journey to help people understand how trauma and toxic stress are impacting us, that it's not what's wrong with us, but it is what's happening that is causing us to sometimes not be well. So this impacts us far and wide as a society, and many have called us this the biggest public health emergency. Mm-hmm. This was before COVID, of course. It is substantial and the impact is significant, and so that is why this focus and why we went down this path.
We have to be involved with the community to really address some of these inequities in housing, inequities in health, inequities in access to health, inequities in education.
What I like about that notion is that it wasn't the board saying you should do this or you should do that, sure. but rather it was the proxy for the people saying, this is what we think we should do. This is why we think it would be more effective in the long run for the communities that we're trying to serve.
Two powerhouses have now united with a promise of health equity. Together, they envision a world of zero health disparities. Their shared vision, advancing health equity across Missouri and beyond.
It's exciting because it's going to give us an opportunity to create, I would say, like this social bridge across the state between the West, the Bootheel, and the East. And we're going to have this opportunity to share all of this knowledge, all of these social resources. And the more we can build that and we can expand those lanes of that bridge, the impacts that we can make in all of the communities and across the state, and then hopefully replicate this across the country.
I'm just so excited that we are a part of it, because in the past, it always has been Kansas City, it always has been St. Louis, and we at the bottom of the state, so a lot of that wasn't making it here. And so now that we're on an even scale with St. Louis and Kansas City, that even makes me more excited because we're getting what they're getting. And what makes it even greater is that the Regional Health Commission and Alive and Well has put things together that introduces us to new ideas, new ways of thinking, new opportunities.
This merger is really good for Missouri because St. Louis has had an opportunity to begin to feel what it feels like to have trauma and recognize that you have trauma when you're physically ill. Now the state of Missouri is going to get that opportunity. And believe me, the circumstances in St. Louis are the same circumstances that I've seen in other parts of our state, sometimes even worse, because they're not quite sometimes where we are in the city and urban areas.
Well, I'm excited because there's a lot of expertise. The Regional Health Commission has been around for a long time, fighting inequities and looking at things kind of from outside the box and how to improve health for their community.
And so when we talk about racism and justice or lack of health care access, or mental health or lack of access, or lack of understanding of those things, particularly for Black and Brown people, those are who's most burdened. And our systems were not truly designed to support them, education included.
Disparities in life expectancy, rooted in decades of systematic inequities, are more than mere statistics. They're stories of lives, just waiting to thrive.
But I'm really happy about it because we're diving into health disparities, and mental health on top of that is a huge need in our community. And so I'm just really excited for me to be educated more and to really just see what we can do to help bring awareness in our community and to see where our merger goes in the next couple of years and how we affect our community.
Our mission is clear. We envision communities across Missouri becoming and remaining alive and well.
Let me tell you, this is a beautiful culmination of vision, hope, and aspiration. To have community and those deeply embedded relationships and systems on those hard-fought, well-earned relationships coming together and believing that we can co-create change to transform our state and get to zero health disparities. If that doesn't inspire you, I don't know what will.